Okay, good evening, students or trainees and learners. Good evening. Good evening, class.
Good evening to you.
Okay, welcome to our today's session, and my name is Madam Mercy Korir, and I will be taking you through pharmacology session for today. So most of us, the applied biology students, we've learned this course before or earlier in our college. So I know you people, you are familiar with these things. So for today, I have some notes here. I hope you people are seeing. Simnaona, you are seeing this. You are seeing what I'm presenting. Someone to respond, please, so that I can know that tuko pamoja.
Tuko pamoja.
Tuko pamoja. Okay, thank you. Thank you, Joyce. So for today, the first thing to know about pharmacology, it basically deals with drugs. So on my screen, I have a question that I've displayed for you. So what are drugs? Can someone try? You can as well read or try on your own words without reading this one. Can someone try, please? Anyone? Mercy, Joyce, Faith?
A drug is any substance that is administered to the body.
This trial, Joyce. Anyone? Anyone else? Can someone else try? Sydney, Mercy.
A drug is any substance that alters the functioning of the body system.
Nice, that's good. Okay, as you all see, a drug is any substance other than normal constituents that alters the body system. So that's all about a drug. So for today, basically, that was just an introduction, by the way. So for today, we look at mode of classification of drugs. Then we'll move to the next topic. So I would like to appoint anyone to take us through this mode of classification of drugs. I've just displayed for you. We'll just read on your side. So can anyone read for us so that I can explain later? Someone to volunteer, please. Mercy or Joyce or Faith, anyone? Volunteer. We just read the displayed notes.
Mode of classification of drugs.
Yes.
There are different ways to classify drugs based on their mode of functions, which is how they produce their effects on the body. Some of the common modes of functions are topical antibiotics, cough or suppressants, anti-HAG drugs, anti-emetic drugs, antifungal drugs, antacids, analgesics, and non-steroidal anti-inflammatory drugs.
Thank you so much, Mercy, for that. I appreciate. So, continuation here, from what Mercy has read is drugs are classified. We all know there is drugs, but these drugs are classified. So we have topical antibiotics, we have antiseptics, we have antacids, we have antifungals, and yes, for that case, I've given you 8 of them, but I'll explain 4 of them. So I'll start with the topical antibiotics. From the word antibiotics, we all know antibiotics. Sisi wote tunashikwa na infection and we all know what is antibiotics. So these are medicines that are applied to the skin to kill bacteria and helps in preventing the infection. Understood? Any question? Ama unaelewa? It's self-explanatory kind of. The next one is antiseptics. These are medicines that are used to slow the growth of germs and they help in preventing infection in minor cuts, scrapes, and burns. Examples are aspirin. The next one is antacids. These are the medicines that neutralize stomach acid and they are used to relieve acid ingestion, upset stomach, sore stomach, and heartburn. This, for the people who have H. pylori, ulcers, these are the medicine for that problem, for that kind of disease. And antifungal drugs, these are medicines used to treat fungal diseases. Any question? Joyce, you have a question? I can see your hand is up. Joyce,
Yes.
your hand is up.
Sorry.
No problem. I thought you have a question. But you have all understood about the classification of drugs. Anyone with a question? Can we move on? Okay, I assume we are all okay. So our next subtopic actually is factors affecting mechanism of drug action. And I will also need someone else apart from Mercy to read for us the displayed notes. Joyce, can you do that for me? Joyce, are you in a position to? Okay, if you are not Mercy, Faith, or Matty, or Stella,
Okay, come
or
again.
Sydney, can you do that for us? Can you read for us?
Factors affecting mechanism of drug actions.
Yes, take us through that, please.
Okay, some of the factors that affect the mechanism of drug actions are as follows. Patient state or a patent, route of administration, physiological factors, environmental factors, the dose, anatomical site, health conditions, and other medications.
Thank you so much, Joyce. That was Sydney or Joyce. Thank you so much. So,
Joyce.
okay, thank you so much. So the first one is patient state. So when the state of the patient is vital to dosage formulation. When you find a dehydrate, of course, we all know patients. We've interacted with people who are sick, and most of the time, when a person is dehydrated, doctors don't administer the drugs through their veins, and through intravenous, because the veins have collapsed during that time. And when the veins and when drugs are administered, there will be no action because blood at that time is not moving in speed. So the next is route of administration. So drugs can be given by different routes, such as oral, we all know, like Panadol, cetirizines, intravenous, like for IV, like I don't know really for now, intramuscular, subcutaneous, etc. Sorry, someone is raising their hand. Mercy, you are raising your hand. Something wrong? Mercy. Mercy, you are raising your hand. Mercy. Okay, thank you, Lord. So as I was saying, factors affecting mechanism of drug action. We are, as Joyce has stated earlier, we have patient state, we have route of administration. This is a site where the drugs are administered. We also have physiological factors. These are the characteristics of the individual that can influence the response to a drug, such as age, sex, body weight, genetics, liver, and kidney functions. For example, older people may have reduced liver and kidney functions, which can affect the metabolism and elimination of drugs. The next one is environmental factors. These are the external conditions that can modify the effect of a drug, such as diet, temperatures, light, noise, stress, etc. For example, some food can interact with drugs and alter their absorption or metabolism. Like, for example, grapefruit. Grapefruit juice can inhibit an enzyme that metabolizes many drugs, leading to increased blood level toxicity. Temperature can also affect the blood flow and distribution of drugs. We also have dose. For the dose, if the dose is low, the drug will not work. And if the dose is too high, it becomes toxic to the person. Adequate dose is important in order to achieve therapeutic concentration. Joy, you are raising your hand. Okay, thank you. Anatomical sites. Joy, are you okay? Okay, for the anatomical site, some body parts are protected by blood barrier, e.g. blood-brain barriers, which protects the brain. For this case, blood-brain barriers have that, this is the barrier that protects the inner part of the brain so that some drugs cannot alter their functions. And also we have blood-testis barrier, which also protects the testis, and the placental barriers, which protects the placenta. Therefore, these are said to be privileged substances, or these are said to be privileged substances that prevents from reaching these areas. Let's proceed to the next one, which is health conditions. If a person has certain health problems like liver or kidney disease, they might process drugs more slowly. Also, some condition might change the way a drug is distributed in the body. Any question up to that point? Class, any question? Let's interact. Let's have an interactive class, please. Joyce, say something.
I think the points are well illustrated.
They are self-explanatory. Thank you. Not yet, not yet. We are in the last points. This is other medications. If a person is taking more than one medication, those drugs could interact with each other and change how they work. Like when in this side, you are taking antibiotics. This side, antacids. The other side, antiseptics. Of course, it can't work. They will mix up in your body, and you will end up being more worse. You will end up being sick.
Toxic.
Yes, it will be toxic in your body. That was the end of my session. I hope you all people understood everything. Anyone with any question? So I will stop sharing the screen so that we can review our session. Joyce,
Yes.
remind us what we've learned today.
Come again.
I'm saying remind us what we have learned today.
Okay, today we have learned about the definition of drugs. And you told us that drug is any substance other than normal constituents of the body, which is applied or introduced into a living system with the effect of altering the body functions. Also, you have added about the mode of classification of drugs. Thereby is where we find the drugs being classified into different categories, whereby we have the topical antibiotics, the cough suppressants, anti-aging drugs, anti-hemorrhoid drugs, antifungal drugs. Under that, you have also carried us under the factors affecting the mechanism of drugs action, whereby you find the anatomical site, the health conditions, and other medications.
Nice. That was good. Thank you so much, Joy. Anyone? Mercy? Faith? Remind us what we've learned today. Okay, I hope we are all okay. Thank you so much, guys, for attending this class. I appreciate. May you have a lovely evening ahead and good night.
Thank you. Good night.